this is Dr. Jake.
Hi, this is Dr. Jake McCrowell at Direct Performance Physical Therapy. I'm going to take you through what a treatment at Direct Performance may look like. So after a thorough movement assessment and history from the patient, we see and look for specific limitations or deficits in the patient. And we're going to try to fix those mechanical deficits. So for this patient specifically, we saw some lat tissue extensibility deficits or lat tightness. So we start off by facilitating that muscle to loosen up. We found some active trigger points in that lat that were causing pain and causing range of motion and muscle activation limitations, again from our assessment. So we start off by facilitating that muscle to loosen up, release, reset, and go back to its normal length and tension.
One way we do that is
through dry needling, as well as intramuscular stimulation through the dry needles. There's a lot of other effective strategies, but for Phil and for this specific limitation, we found that would be a really effective facilitative technique for him.
And here you can see
the patient's muscle jumping, and that's just a way for us to make sure it loosens fully.
Afterwards,
we want to
make sure that
muscle is
integrate
the new range of motion that we picked up for the dry needling from the facilitative technique. So we're making sure that we use and stretch out that tissue afterwards. So we're stretching out the lats here and making sure we're getting an increased range of motion that we had previously. Afterwards, we test or post-test and make sure that we see some sort of gain quantitatively and qualitatively. Basically, we want to see that it moves better and is starting to already feel better after a few of our strategies. From there, we want to ensure the patient has the proper strategies to maintain those gains. So first, Phil's going to stretch that tissue out just like we did for him, but wait for him to do that on his own. Making sure that the patient is doing the technique correctly and feels very confident that they can reproduce this on their own. Along with some obvious opportunity to tell bad jokes with each other.
From here, we're going to
load the tissue to ensure that we retain the quantity and quality of movement that we gained. So loading tissue allows us to improve muscle and retention. So as he does a strength exercise specifically, we call this a dead bug lat. Allows us to make sure he gets the right firing patterns as well. From there, we go to practice engaging the lats in functional movement. For him, it was for a pull, for his clean. So we make sure that we go through, this is using a technique called reactive neuromuscular therapy to ensure that he gets a little additional lat engagement and that the lat feels better and ready for return to his activity.
So there you have it.
It's using multiple techniques and strategies to ensure that we can get the best outcomes for our patients, combining our manual and exercise to make sure the muscle is moving better and feeling better and ready to perform better. So if that's something you're interested in, give us a call.